Hi, my name is Heather Wilson, and in this video, I will introduce you to the medical insurance options you have as a ViewPoint employee. ViewPoint offers you 5 medical plans. You can choose the plan that best meets your needs and the needs of your family. Before we begin our discussion, let's discuss some medical terms. An HMO plan is a managed care plan. When you choose an HMO, you choose a primary care doctor, PCP, and this doctor will be responsible for directing your medical care. This doctor will act as a gatekeeper for your access to care from specialists. The out-of-pocket costs on an HMOs are usually lower than a PPO plan. A PPO medical plan allows you more freedom in accessing care. There are no primary care doctors on a PPO plan. There is a network of medical providers that are contracted with the insurance company to provide services for you at PPO discounted rates. You may see any provider you wish, but your costs will be lower when you ensure you choose an in-network doctor, medical facility for blood work, x-rays, hospitals, urgent care, etc. PPO plans will have higher out-of-pocket expenses than HMO plans. HSA is a PPO plan that allows you to have tax-advantaged savings account to pay for medical expenses if you choose. There are 2 components to the HSA plan. 1, the Anthem PPO plan, and 2, a pre-tax savings account through a financial institution. Your monthly premiums are deducted from your paychecks, and you may open a health savings account and have deposits deducted from your paycheck on a regular basis. For additional information on these accounts, please visit the HSA savings account video, which goes in greater detail. Services are covered at 100% under all ViewPoint medical plans. On the PPO and HSA plans, you must use an in-network provider to receive preventative care at no cost. A list of services covered under preventative care is available in Human Resources Department. A copay is the amount you will pay for services. Copays are a flat dollar amount, such as $20 for an office visit. A deductible is the amount you pay each year before your insurance starts paying for anything. The exception is for preventative services. Deductibles are based on a calendar year which begins January 1st and ends December 31st. Coinsurance is your share of the cost of a covered health service calculated as a percentage of the allowed amount for the service. Out-of-pocket maximum is the most you should have to pay for your health care in the calendar year. It protects you from a very high medical expense. If you reach your out-of-pocket maximum, your health insurance will pay 100% of the allowed charges for the remainder of the year. For both PPO options, PPO and HSA, if you step outside the in-network providers, the out-of-pocket maximum does not apply, as you would continue to be responsible for the amounts that are over the allowed amount for service. A quick word about saving money on prescriptions. All the plans offered by ViewPoint have a mail order incentive for prescription drugs. If you are using a medication that you take every day, you can save 25% on your cost of the prescription by signing up for mail order delivery of your prescription. By electing mail order, you will save 1 copay each quarter for each drug you receive by mail order. Let's talk about the 5 medical options ViewPoint offers, 3 HMOs and 2 PPOs. Kaiser is a one-stop shop for medical care. A typical Kaiser facility will include on-site primary care and specialty physicians, a pharmacy, a lab, x-ray, and radiology services. If you are admitted to a hospital, in most cases, it will be to a Kaiser hospital. Now let's look at the specifics of a Kaiser Permanente plan. A Kaiser doctor visit is a $20 copay. There is no charge for lab services, x-rays, or complex radiology such as an MRI. If you are admitted to the hospital, there is $100 per admission copayment. And if you have surgery in an outpatient setting, you will pay $20 per procedure. Your prescriptions are $10 for a 30-day supply of generic medication and $20 for brand drugs. Remember, you can receive a 100-day supply for 2 copays by using mail orders. An emergency room visit is a $100 copay. Your out-of-pocket maximum is $1,500. Now let's review the 4 plan options. These are offered with Anthem Blue Cross. There are two HMO options, the Anthem Premier HMO and the Select HMO plan. The plan benefits on both plans are very similar. If you choose the Premier HMO, you will have a larger selection of HMO providers to choose from your primary care doctor. The Select HMO plan also has a large selection of providers to choose from, but fewer than the Premier plan. The Select network of doctors is a subset of the Premier doctors. There is no deductible on either HMO plan. The office visit copay for the Premier plan is $20 and for the Select plan it is $15. There is no copay for X-ray and lab work under either plan. If you need complex radiology such as an MRI or CAT scan, there will be a $100 copay under either plan. If you are admitted to the hospital, the copay on the Premier plan is $200 and on the Select plan it's $100. This copay is per hospital admission and not per day. Outpatient surgery is a $100 copay on the Premier plan and $50 on the Select plan. An emergency room visit is $100 on either plan. Prescriptions are $10 for Tier 1 drugs, $25 for Tier 2, and $45 for Tier 3 drugs on both plans. The annual out-of-pocket maximum is $1,500 on either plan. The PPO and HSA plans allow you the greatest freedom when you need medical care. There are two levels of providers and benefits under the PPO and HSA plan, in-network and out-of-network. In this video, I will highlight the in-network benefits. Anthem has in-network providers in all categories of medical care: physicians, labs, hospitals, outpatient surgery centers, pharmacies, etc. If you choose a provider that is out-of-network, your out-of-pocket costs will be significantly higher than if you choose an in-network provider. When Anthem processes an out-of-network claim, they will determine the allowable amount for services that were rendered and then pay a percentage of that amount. You will be responsible for 100% of charges that are over the allowed amount in addition to your coinsurance. When using an out-of-network provider, there is no limit to your out-of-pocket exposure. Now let's look at the in-network benefits for the Anthem PPO plan. Office visits are a $30 copay on this plan. Other medical services in network are subject to a $500 annual deductible. You will be responsible for paying this $500 before Anthem will be paying anything toward expenses. If you cover other family members on this plan, they will also have their own $500 deductible. Once you have satisfied the deductible, you will have a coinsurance of 20% for covered services, meaning you will be responsible for the percentage of allowed charges. Prescription drugs are $10 copay for Tier 1 drugs, $30 for a Tier 2 drug, and $50 for a Tier 3. The out-of-pocket maximum on this plan is $3,500. The final plan offered is the HSA Health Savings Account. The HSA plan is a PPO plan, and you have access to the same large network of providers as the Anthem PPO. The HSA plan has a $2,500 deductible for single-party coverage. All services are subject to this deductible. If you enroll in the HSA plan and also cover family members under the plan, the deductible will increase to $5,000. This is one combined deductible for all family members, and the $5,000 must be met before Anthem will begin to pay for services. You will pay the billed amount for office visits and prescriptions prior to meeting the deductible. Once you meet the deductible, all services in-network will be covered at 100% except for prescriptions and durable medical equipment. Prescription copays once you meet the deductible are $10 for Tier 1, $30 for Tier 2, and $50 for Tier 3. Your coinsurance for durable medical equipment will be 50% once you meet the deductible. Like all other plans, in-network preventative care is covered at 100% with no out-of-pocket expenses to you. You may open a tax-advantaged health savings account with a financial institution. At ViewPoint, we use Benefit Wallet as our HSA savings institution, but you are free to choose your own institution. The deposits you make into this account are not subject to federal income tax. You can withdraw funds from the account to pay for medical expenses, and those withdrawals would not be subject to federal income tax. You would have access to the funds in the HSA savings account through a debit card or check. I hope you have found this overview of the ViewPoint medical benefits very helpful. For more details, please refer to the ViewPoint Employee Benefit Overview available from Human Resources. This video is a brief overview of the medical plans offered by ViewPoint School. For a complete description of benefits and exclusions, please consult the individual contracts. In event of a confliction between this video and the contract will govern.